The fluorescent lights hummed like distant helicopters. St. Michael's trauma unit in Raleigh smelled of antiseptic and burnt coffee, the kind that had been sitting in the break room pot since 5 a.m. Katie Morrison didn't notice the smell anymore. 3 years of 12-hour shifts had made it invisible to her the way soldiers stop hearing mortar fire. She moved through morning rounds with the kind of efficiency that made other nurses look slow. Not intentionally. Just the way hands that have held organs together under fire tend to move faster than hands that haven't. The residents called her efficient. Dr. Pierce called her something else, usually when she wasn't in the room. The trauma bay was already humming at 7:17 a.m. A motorcycle versus a pickup truck on Interstate 40. The motorcycle had lost. Katie was straightening the suction lines when she felt the presence before she heard the footsteps, the way you feel someone watching you from across a room. Dr. Pierce. Chief of Surgery. 62 years old, Rolex Submariner with a scratch on the face that he'd been wearing for 8 months without getting it fixed, which told you everything you needed to know about a man who had enough money to replace it but not enough ego to admit he'd made a mistake. Morrison. Not a greeting. A label. The way you'd say scalpel or sponge. She didn't turn around. Just finished adjusting the oxygen flow, her hand steady as surgical steel. Morning, Dr. Pierce. He stood in the doorway, chart tucked under his arm like a weapon, watching her work. Katie had learned to move through his gaze the way water moves through a sieve, letting it pass through without catching. She'd been doing this long enough to know the calculus: correct him in public, you're ambitious. Stay quiet, you're competent. Push back, you're insubordinate. The resident assigned to the motorcycle case was Marcus Webb, 3rd year, smart enough but still learning the difference between what the textbook said and what actually happened when human bodies broke against moving steel. Katie liked him. He tried. She could always work with someone who tried. Vitals? Dr. Pierce moved into the bay like he owned it. Which, technically, he did. BP 118/72 unstable, Marcus said, eyes on the monitor. O2 sat holding at 96. Heart rate 88. Responsive, alert and oriented. Complaining of right shoulder pain. Katie was already running her hands along the patient's ribs, feeling for the fractures that the CT would confirm in 30 seconds. The patient flinched. That flinch told her more than any machine could, not just the pain location, but the quality of it, the way the body speaks a language that monitors don't understand. Field surgery had taught her that. Field surgery taught you to listen to skin and breath and the small sounds people make when they're trying not to scream. Contusion, Dr. Pierce said, glancing at the preliminary imaging. No pneumothorax. Discharge him with pain management and a sling. Katie's fingers stopped moving. She didn't look up. She didn't change her breathing. Just kept her hands on the patient's ribs, feeling the subtle shift in bone density that meant something was wrong with what his eyes were seeing. Take him to imaging, she said quietly. Get a high-resolution CT of the chest wall. Dr. Pierce turned his head. His face was the color of someone about to say something he'd regret. I don't need a nursing assessment of my clinical judgment, Morrison. She finally looked at him. Her eyes were the color of concrete after rain, all surface, nothing reflective. Just doing my job, Dr. Pierce. Marcus Webb was suddenly very interested in the saline bag. The patient's monitor beeped its steady rhythm. Someone in an adjacent bay called for a nurse. The hospital kept breathing, indifferent to the small collision of egos in Trauma Bay 3. The imaging is clear, Dr. Pierce said. His voice had that tight quality now, like a wire being wound too tight. Contusion. Sling. Discharge. Katie's hands came away from the patient's ribs. She straightened up, turned toward the imaging station, and said nothing. Saying nothing was its own kind of response. It was the sound of someone who had already won the argument and didn't need to prove it. 30 minutes later, the high-resolution CT came back. Pneumothorax. Small, but present. The kind that could collapse a lung within 4 hours if you sent the patient home to rest and hope. The kind that kills people when they're sleeping because they get too comfortable and stop breathing consciously and forget to wake up. Dr. Pierce looked at the image. Katie watched his face, not maliciously, just the way you watch weather patterns when you know you're about to stand in them. His jaw worked. His hand tightened on the chart. His eyes moved from the CT to Katie, and in that moment, she saw something shift in him like a door slamming somewhere deep. Not anger. Anger was too simple. This was resentment, pure and crystalline, the kind that doesn't fade with time. It compounds. You flagged an imaging result that the radiologist cleared, he said. His voice was quiet. That was worse than yelling. Quiet voices in hospitals preceded bad things. I flagged a clinical finding, Katie said. She was still looking at the monitor, at the small dark wedge that meant the difference between this patient going home in a sling and this patient going home and not waking up. The imaging tech doesn't do bedside assessment. I do. You're a nurse. The words hung in the air like smoke. Katie's hand stayed at her sides. Her shoulders didn't tense. The trembling that was building in her chest, and it was building, a small earthquake happening in the basement of her ribs, stayed exactly where it was. Not suppressed. Contained. There was a difference. Suppression meant you were afraid. Containment meant you had a choice and you'd already made it. Yes, she said. I'm a nurse. Dr. Pierce walked away. Just turned and walked, his Rolex catching the light as his hand swung, the way a gun catches light when you're looking for a reason to use it. Behind him, the chart dangled from his fingers like he'd forgotten he was holding it. Marcus Webb let out a breath he'd been holding. That was incredible. The way you... Get this patient prepped for chest tube insertion, Katie said. We'll do it here. Local anesthetic, procedural sedation, 28 French tube on the left anterolateral second intercostal space. Tell anesthesia to have my dazolam ready. She walked to the supply station without looking back, her movements precise as a choreographed sequence. Her hand selected the chest tube kit, sterile, sealed, the curved needle already loaded, and began laying out the instruments on the field. Someone had taught her to do this under fire in a military hospital tent outside Kandahar, and the way you learned it there stayed with you. It became part of your nerve endings. The fluorescent lights hummed above her, and somewhere in that humming sound, she heard the rotor wash of a Black Hawk helicopter and the voice of a young lieutenant calling out her status over the radio, and the sound of a folded flag being pressed into her hands at her husband's funeral 5 years ago. Before any of this, before Raleigh, before St. Michael's, before Dr. Pierce had any idea what he was standing next to. But that wasn't the worst part. The worst part was knowing that this moment, this small, perfect moment where she was right and he was wrong, wasn't going to end this. This was just the beginning. Morning rounds began at 0700 with the surgical team clustered around the beds in the ICU, and Katie had already been awake for 2 hours, reviewing charts in the pre-dawn darkness of the nurse's station. She moved through the unit with the kind of efficiency that came from 3 years of reading a room before the room knew it needed reading, for lines checked, medication drips calibrated, vital signs logged with the precision of someone whose hands had learned to trust data over instinct. At least, that's what the charts showed. What they didn't show was the tremor in her jaw that morning, the way her fingers had pressed against the faded scar on her collarbone under her scrubs while she waited for the rounds to begin. Pierce arrived like weather, pressure dropping, temperature shifting. He wore his 15 years of surgical experience like a uniform, tailored suit under the white coat, Rolex catching the fluorescent light, and his eyes had already begun their predatory scan of the unit before his shoes crossed the threshold. Katie was standing at the bedside of Mr. Chen, no relation to the commander who would arrive in her life like a grenade, a post-operative spinal fusion patient 3 days out, moving slow but moving, his wife holding his hand while their daughter watched from the doorway with the particular anxiety of people who had learned not to trust hospitals. Interesting theory, Nurse Morrison, Pierce said, not to her but to the surgical residents flanking him, his voice the exact calibration of a knife, smooth enough that the family wouldn't quite register they'd been cut. Katie had been reading the patient's response to the post-operative pain management protocol, noting that Mr. Chen's blood pressure was trending lower than expected, that his respiratory rate was creeping up, that something in the constellation of vitals didn't align with a routine recovery. But perhaps we should leave a diagnostic thinking to those who actually attended medical school. The room went still. Not a dramatic hush, just the absence of movement that happens when people suddenly understand they're witnessing something they shouldn't. Katie's face didn't change. She didn't blink. Her eyes moved to Pierce with the flat, glacial quality of someone looking at a wall. She counted 3 heartbeats. Around them, the ventilators wheezed their mechanical rhythm, the monitor beside Mr. Chen beeped its steady pulse, and the daughter's hand tightened on her mother's shoulder. "Strange how your ego bruises easier than your patients do, Doctor," Katie said. Her voice was quiet, not soft, quiet. There was a difference. She turned and walked away, her shoes clicking once, twice on the tile floor, each step a sound like closing doors. Pierce's mouth opened. Nothing came out. The residents stared at their shoes. Mr. Chen's wife squeezed her husband's hand so hard his foresight threatened to bleed. But that wasn't the worst part. What happened next was the architecture of his revenge. By noon, rumors were moving through the unit like contagion. A medication count discrepancy 3 weeks ago, something about fentanyl patches, something about the pharmacy logs, something about Katie's handwriting on a form. By 1400, Pierce had seeded doubts with the board members during his lunch meeting, behavior becoming increasingly erratic. Questions her own competence by overstepping. By 1600, 2 nurses Katie had trained were suddenly unavailable when she needed assistance. By 1800, the break room had become a study in orchestrated exclusion. She sat at the table with her tray, reheated chicken, overcooked vegetables, the kind of lunch that tasted like obligation. Rodriguez, the IT tech who usually brought her coffee, suddenly remembered he needed to inventory the server room. The 2 residents who joked with her yesterday found urgent pages requiring their immediate attention. A nurse Katie had covered for 3 nights straight on a family emergency discovered that the break room was too crowded, and could she eat in the medication dispensary instead? One by one, chairs stayed empty. The room emptied in 90 seconds, bodies and eyes and voices fleeing like prey sensing apex predators. Katie ate. Methodical bites. Steak knife-like focus on her plate while the fluorescent lights hummed overhead and the rain began hammering the windows outside. She didn't look up. She didn't track the departures. She simply ate with the kind of steady concentration that comes from doing exactly what you came to do regardless of witness or absence of witness. Her hands were steady. Her breathing was even. The tremor that lived in her jaw these days never reached her face. By the next morning, the disciplinary notice was waiting. She saw it before shift change, before the day nurses arrived, when the unit bulletin board still held the small mercy of being mostly unwitnessed. The memo was printed on institutional paper, dated and signed, disciplinary notice. Her name in the subject line. The violation listed with bureaucratic precision, unauthorized patient advocacy. Staff member N. Morrison exceeded scope of nursing practice by providing clinical opinions to patient family members regarding post-operative management, directly contradicting physician guidance. This behavior undermines physician-nurse hierarchy and compromises patient trust in the treatment team. Code 4, you questioned the doctor and he knew it. She read it twice. The second time, Pierce appeared beside her as if summoned by her concentration. He was already in scrubs, coffee in hand, his voice pitched just loud enough for the station to hear, and not shouting, which would look unprofessional, but audible, clear, the kind of volume that ensures an audience. Cowboy nursing, he said. Think you know better than 15 years of surgical experience. His eyes were bright with satisfaction. He was winning. He could see the other nurses watching, see the shift in how they held their bodies, see the understanding spreading. Katie Morrison was becoming a liability. She didn't respond. Her jaw clenched once, the only movement in her entire body, and then her eyes locked onto his with a kind of intensity that came from somewhere deeper than professional irritation. It came from the same place that had performed an emergency field thoracotomy with a combat knife while incoming rounds scattered dirt across a patient's sternum. It came from the kind of calm that emerges when you've already survived the worst thing you thought could happen to you. He looked away first. His coffee cup was suddenly very interesting. By the time he turned back, Katie was already moving toward the medication dispensary, the moment crystallizing behind her, not forgotten, just filed. That evening, she was loading her car in the Raleigh rain, which felt like it had something to prove, hammering the parking lot with the rhythm of artillery. Pierce's BMW pulled out of the executive spot, and Katie watched him drive away, watched the rear lights disappear into the darkness, and her hands on her steering wheel went white-knuckled. The rage didn't show on her face. The rage never showed anymore. That was the thing about having survived what Katie had survived. You learn to keep the explosions internal, learn to let them burn through your veins in perfect silence while the world saw nothing but composure. Her phone lit up with a text from Daniel. "How's work, Mom?" She stared at the screen for a long time. Typed and deleted, complicated. Typed and deleted, people are disappointing. Finally, she sent, same as always. Which was only technically a lie. Same as always, except nothing was the same anymore, except the grief she carried had a shape now, and that shape was walking the same hospital corridors she did. That night shift began at 2100, and by 01:30, the unit had a new admission. The boots came first, the sound of them echoing down the hallway with military precision, multiple pairs, the kind of synchronized footfall that told you something was wrong before your brain caught up to the information. Katie was at the nurse's station when the team came through the ER doors, Navy SEAL Team 3 operational support, uniforms still carrying the dust of the day, moving with the particular focus of people who understood that speed and efficiency were the only language that mattered in moments like this. The gurney they were rolling was carrying a man in his early 40s, dark hair, the kind of jawline that came from genetics and discipline, his skin already pale from what looked like post-operative complications. "This is Commander Marcus Chen," the lead SEAL said to the trauma coordinator, his voice clipped, precise. "Transferred from military medical facility. Routine post-op from abdominal wall reconstruction, complications during transport. Currently stable but needs level 2 monitoring and surgeon on call." Katie's hand stilled on her keyboard. Not visibly. Barely. Just a micro-pause that lasted exactly long enough for her pupils to dilate and her breath to catch somewhere in her throat. She didn't move. She didn't look up. She absorbed the information the way she'd been trained to absorb information, completely, instantly, without betrayal. Commander Marcus Chen. The same Commander Chen who had led her son's platoon through 3 deployments in the Hindu Kush. The same officer who had come to her door 5 years ago in his dress blues, holding a folded flag, his eyes carrying the weight of news that would fracture her life into before and after. By the time she risked looking at the gurney, Pierce had already appeared, already made the calculation that military brass meant media potential, meant recognizing the opportunity and sliding into it with the smoothness of a man who understood how to weaponize proximity to power. He was taking the case personally. Special attention. Best care available. And then, to Katie, his voice dropping to something that might sound like delegation but landed like a shackle. Standard post-op monitoring only, Morrison. Vitals every 2 hours, nothing else. I know you have trouble staying in your lane. She nodded once. Her effect completely flat. Not deferential, not yet, that mask was still in place. But something had shifted behind her eyes, something that made the air in the room change pressure. At 0200, when Katie checked the commander's vitals and his eyes opened, she saw the moment recognition hit him. His eyes tracked to her name badge, lingered there, and then moved up to her face. What he saw was a trauma nurse in navy scrubs with her dark hair pulled back and her composure locked down tight. What she saw was a ghost from the life she'd been trying not to remember. Neither of them moved. Neither of them spoke. Around them, the monitors beeped their steady rhythm, the ventilators wheezed, the rain continued its assault on the windows. In that moment, suspended between her 2 identities, Katie Morrison understood that everything was about to change. The boots came first. echoing across the ICU tile like a metronome counting down to something neither of them could stop. Rubber soles, mil-spec Dana reckonings, the kind that left imprints on forward operating bases in the Hindu Kush. Katie didn't look up from the medication cart. Didn't need to. She'd heard that particular rhythm through 3 deployments, the gait of a man who'd learned to walk through fire. Incoming, one of the floor nurses whispered. Whole tactical team. Someone important. The stretcher swept past her station with the precision of a choreographed drill. For Navy personnel in dress uniforms, moving like they'd rehearsed this exact scenario 100 times in 100 places where the sky burned. The patient was pale, vital stable, post-op from a routine procedure at a military facility upstate. Routine. The word sat wrong in her chest the moment she read the chart. Commander Marcus Chen. 3rd Battalion, 5th Marines. The name hit her like a pressure wave. Katie's hand stilled on the 4-line she'd been preparing. Her breath didn't change. Her jaw didn't clench. But somewhere in the lower chambers of her heart, a door that had been sealed for 5 years shifted on its hinges. Chen had led her son Daniel's platoon through Sanjin Valley. Had been there during the siege that lasted 12 hours and took 2 Marines with him. Had come to her house in dress blues and presented her a folded flag with hands that trembled, the only time she'd ever seen Marcus Chen's composure crack, standing in her living room while the rain hammered against the windows and Daniel watched from the stairs with a 17-year-old's helpless fury. That was before Operation Copper Dagger. Before Katie Morrison died in a medical tent outside Kabul. Before the Pentagon ensured no records would ever surface. She updated his chart from a distance, watching him settle into the ICU bed like a ship finding harbor. Chest wound clean. Monitors beeping their steady reassurance. Surgeons didn't usually place high-value military patients in regular ICU beds, but Pierce had signed off on it, had probably seen the patient classification and decided a Navy SEAL didn't warrant his personal attention. Routine surgery. Routine recovery. Routine bureaucracy. Katie knew better. She'd learned in the field that routine was where catastrophe lived. At 0600, the monitors changed their song. The first alert was soft, a single beep, the kind that usually meant nothing. Katie heard it anyway. Registered it while updating another patient's fluid balance for beds over. The second alert came faster. Then a third. She moved toward Chen's bed without thinking about it, without asking permission, the way her body had learned to move when lives hung in calibration. His blood pressure had dropped 8 points in the last 40 minutes. Subtle. Barely worth mentioning. But the systolic kept sliding downward, and his oxygen saturation was holding steady only because the ventilator was working to compensate. Katie placed a gloved hand against his chest and felt it, the faint crackle of subcutaneous emphysema, air tracking through tissue planes where air shouldn't exist. Not from the initial incision. From somewhere deeper. Internal bleed. The hemorrhage was small still, but bleeding nonetheless, and small bleeds became catastrophic ones with the kind of speed that made seconds feel like minutes and minutes feel like mistakes you'd spend the rest of your life regretting. She paged Dr. Pierce at 0605. Waited exactly 4 minutes for him to respond, her fingers steady on the phone. He arrived at 0625 moving with the theatrical slowness of a man pulled from sleep who resented every second of the interruption. White coat unbuttoned. Hair still bearing the impression of a pillow. His face arranged itself into the expression he always wore when Katie spoke, polite contempt, the look of someone examining an insect that had somehow acquired the ability to talk. What is it, Morrison? Not Captain. Not even her full title. Just her last name, stripped of dignity, spoken like something he'd stepped in. His pressures dropped 9 points in the last 20 minutes, Doctor. Subcutaneous emphysema tracking up the neck. Katie kept her voice level, clinical, the way she'd learned to speak when there was a body on the line. I think there's active bleeding from the surgical site. Pierce moved to the monitors with the unhurried confidence of a man who'd never been wrong in his life. Glanced at the numbers. Glanced back at her. His smile was the smile of a victor. His numbers are within acceptable range. You're being paranoid, Morrison. Post-op patients bleed. It's expected. His vitals are stable. They're trending down, doctor. I said stable. Document the values and stop bothering me about things you don't understand. He turned to leave. Stopped at the doorway just long enough to add, nurses have a tendency to see emergencies everywhere. It's one of your profession's less charming traits. He was gone before she could respond. Katie didn't call after him. Didn't argue. Her job at that moment wasn't to convince Dr. Pierce of anything. Her job was to watch the monitors and listen to the language Chen's body was speaking in the grammar of vital signs and laboratory values and the subtle declination of a man who was bleeding out in increments. 0630, pressure 94/58. 0635, oxygen saturation dropping despite the vent pushing harder. 0640, Chen's skin taking on the peculiar grayness of a body running out of volume. Katie stood at his bedside like a sentry, watching the slow mathematics of hemorrhagic shock unfold with the inevitability of a theorem. The ICU around her continued its ambient symphony, ventilators whooshing, pumps beeping, the fluorescent lights buzzing their low-frequency hum, but she heard only the monitors. Heard only the story they were telling. Heard only the clock inside her chest counting down the seconds between now and the moment when no amount of surgery would bring him back. At 0644, Chen's blood pressure hit 82/42. She didn't page Pierce again. Didn't wait for authorization. Didn't ask for permission, because permission was a luxury corpses couldn't afford. Katie moved to the crash cart and retrieved the emergency thoracotomy kit, sterile field, scalpels, vascular clamps, the instruments that smelled of antiseptic and purpose. Her hands weren't shaking. Her breathing hadn't accelerated. Her voice, when she called for backup, was the voice of someone ordering a coffee, calm enough to suggest that what was about to happen was routine. I need a crash cart at bed 7. Prepping for emergency thoracotomy. Cardiogenic shock, suspected hemorrhage. The ICU exploded into motion. Residents materializing. The respiratory therapist adjusting the ventilator. Nurses positioning equipment. Everything Katie had trained for, everything she'd done in tents under sniper fire when the only anesthesia was necessity and the only sutures were whatever string you could find that wasn't covered in sand. She opened his chest at the 5th intercostal space, the blade moving through skin and ribs with the precision of a woman who'd done this before. The blade was cold. The blood was warm. The moment she breached the pleural cavity, everything else disappeared. There was no Dr. Pierce. No St. Michael's hierarchy. No Captain Katie Morrison pretending to be ordinary. There was only the bleeder, a vessel along the internal mammary artery, still leaking, creating an expanding hematoma that had already cost Chen 3 liters of blood and whatever seconds remained before his heart decided it had nothing left to pump. She clamped it. Forced the hemorrhage closed with her hands and her knowledge and the muscle memory of a woman who'd held lives together in conditions far worse than this. The blood flow reversed. The monitors that had been screaming started to settle. O2 climbing back toward 80. Then 85. Blood pressure responding, creeping upward toward survivable numbers. That was when Dr. Pierce arrived. He stood in the doorway, face white. Not shocked. Not concerned. Something worse. Something that looked like a man watching the architecture of his own authority collapse in real time. Katie didn't look at him. Didn't acknowledge his presence. Kept working, kept controlling the bleed, kept her focus narrow to the only thing that mattered, the man on the table and the next 60 seconds and the margin between success and catastrophe. By 0650, Chen was stable. Pressure 98/61 and holding. O2 sat 89 and climbing. The hemorrhage contained. Katie stepped back from the bedside and peeled off her gloves with the slow deliberation of someone who'd just returned from somewhere very far away and was still learning to walk in normal gravity. Pierce said nothing. Just watched her with an expression that had aged 10 years in 10 minutes. Then he turned and left, his footsteps echoing down the corridor with none of the theatrical slowness from earlier. Just silence and the sound of a man's career making calculations it couldn't complete. 2 hours later, his office. His desk. The papers already arranged, stacked, waiting. Katie sat in the chair across from him, hands folded. Pierce slid the documents toward her like a dealer laying down cards he'd been holding all along. Incident reports. Policy citations. Witness statements he'd cultivated over months, meticulously documented, signed by staff who'd been waiting for permission to tell the truth they'd rehearsed so carefully. Gross breach of scope of practice, he said, his voice steady again, recalibrated, finding solid ground in bureaucracy. Unauthorized surgical intervention. Violation of Joint Commission standards regarding nurse delegation of. I saved his life, doctor. You violated protocol. You exceeded your authority. You performed a procedure that is explicitly the domain of licensed physicians, and you did it without authorization, without supervision, without following the established. Katie looked at the termination letter already centered on the desk. Her name. The date. The finality of it written in serif font and official letterhead. She picked it up and read it the way someone might read the name on a gravestone, with the understanding that some things, once written, become immovable truth. You're done, Morrison, Pierce said. Security has been notified. You'll leave your badge and your credentials at the front desk. And don't bother contacting legal. I have documentation going back 3 years. Unauthorized medication access. Patient advocacy beyond your scope. The board will support this decision. Katie set the letter down carefully. Stood up. Her voice, when she spoke, was the voice of someone standing in a place most people couldn't imagine. I understand, doctor. She left through the employee entrance at dusk. The rain had started again, the kind that made the city smell like rust and concrete and the particular loneliness of people who'd lost everything at exactly the moment when everything mattered most. Her cardboard box was disintegrating in her arms, the bottom already soft with moisture. The cracked mug Daniel had made in 4th grade. A dying succulent. The photograph of her holding a folded flag, the one Marcus Chen himself had placed in her hands 5 years ago while his eyes found hers with a recognition that meant he understood exactly what she'd lost. She didn't know, standing at that bus stop, that Daniel was already moving. Didn't know that a showbox containing medals and ribbons was being carried back through those hospital doors. Didn't know that everything Dr. Pierce had built on her silence was about to collapse in a single moment when the truth, finally, became impossible to deny. Within the hour, Dr. Pierce's office transformed into a war room against a single nurse. He sat at his mahogany desk, morning light slicing through Venetian blinds like surgical steel, and began the methodical destruction of Katie Morrison's career. His fingers moved across his keyboard with the precision of someone who had spent months preparing for this exact moment. Incident report. Then another. Then a third. Each one a carefully worded brick in an impenetrable wall. Gross breach of scope of practice, he muttered aloud, savoring each word like expensive scotch. His paralegal had flagged the Joint Commission regulations, obscure ones, the kind most nurses never heard of, the kind that sounded damning when read aloud in front of hospital administrators. He highlighted passages in yellow. Section 4.2.1, Scope of Licensed Nursing Practice. Subsection B, surgical intervention shall only be performed by credentialed surgical staff under direct physician supervision. He had been cultivating witness statements for months now, casual conversations with nurses who respected hierarchy, who understood the threat Katie represented to the natural order of things. They had written what he suggested. They had signed what he placed in front of them. An email to the board. Then another to the hospital's legal counsel. Subject line, urgent, patient safety incident requiring immediate investigation. He wrote with the careful language of a predator who understood institutional power. He didn't accuse. He insinuated. He didn't demand. He requested formal review. He CC'd the chief medical officer, the risk management director, and the hospital's outside counsel. Each recipient a domino he had positioned years in advance. By 9:24 a.m., before Katie had even finished her shift in the ICU, Dr. Pierce had scheduled a termination meeting for 10:30. His assistant had blocked his calendar. He had printed the incident reports, all of them, stacked in a manila folder, tabs color-coded, each violation highlighted. He had prepared the termination letter on hospital letterhead, leaving only her name and the effective date blank. Everything was ready. Everything was precise. Everything was inevitable. Katie arrived at his office at 10:28, her trauma badge still clipped to her scrub pocket, her hand smelling faintly of the antiseptic soap she'd used after extubating a post-op patient. She didn't knock. Pierce had summoned her with a text message that read, "My office. Now." She pushed the door open and found him behind his desk, the morning light making his face look carved from something cold and unliving. "Sit," he said, not looking up from the folder in front of him. She Saturday. Her hands folded in her lap. Her expression flat as pavement. Pierce slid the first incident report across the desk. It made a soft whispering sound against the wood. "Do you know what this is, Morrison?" "Incident report. This is documentation of a gross breach of scope of practice. An unauthorized surgical intervention performed by a licensed practical nurse without direct physician supervision. Do you understand the implications?" She didn't answer. Joint Commission regulations are very clear on this matter. Section 4.2.1 explicitly states, he was reading now, his voice taking on the tone of a man reciting scripture. Surgical interventions shall only be performed by credentialed surgical staff under direct physician supervision. Not by nurses. Not under emergency conditions. Not when a physician is present, however incapacitated that physician may be. He looked up, and his smile was a wolf showing its teeth. "You performed an emergency thoracotomy. With a scalpel. On a patient. Without authorization." Katie's jaw tightened. Just barely. A muscle worked once beneath her skin. "What you did was not heroic, Morrison. What you did was criminal negligence. What you did was a violation of federal healthcare law." He pushed another document across the desk. "I have 4 witness statements from staff members who observed you performing this unauthorized procedure. Detailed accounts. All sworn. All dated and witnessed." The fluorescent lights overhead hummed their mechanical dirge. Outside his office window, Raleigh was conducting business as usual. Patients were arriving in wheelchairs. Families were sitting in waiting rooms. Doctors were making rounds. The world was turning, indifferent to the fact that Katie Morrison's professional existence was about to be erased. Pierce opened the manila folder. Inside were photographs. Printed stills from the ICU surveillance footage, grainy images of Katie with her hands inside Commander Chen's chest cavity, her face focused with the kind of calm that came from having already survived the worst. He spread them across the desk like evidence at a crime scene. These were taken at 14:41 hours yesterday afternoon. This one is 14:52. This one is 14:58. In each photograph, you are performing a surgical procedure you have no legal authority to perform. He paused. His fingers drummed once on the desk. The hospital's legal counsel has been informed. Risk management has opened a file. I have personally notified the state nursing board. Katie's hands remained folded. Her breathing remained steady. She had been trained to absorb trauma without showing it. She had been trained to function while her world was collapsing. She had been trained by people whose names she could never speak aloud. Pierce slid the termination letter across the desk. It made the same whispering sound. The ink was black. The words were final. "You're done, Morrison," he said, and there was genuine pleasure in his voice. Pure, undiluted satisfaction. Effective immediately. Security will escort you from the building. Your nursing license will be flagged in the state database pending investigation. Any references from this hospital will accurately reflect the nature of your termination. Katie reached out and took the letter. She read it once. She didn't read it twice. Nothing to say. Pierce asked. No dramatic surgical comebacks? No righteous indignation? She folded the letter once. Then again. Then a third time until it was small enough to fit in her scrub pocket. "I've been waiting 3 years for this moment," Morrison, Pierce continued, leaning back in his chair like a man settling into victory. "Waiting for you to make a mistake. Waiting for you to overstep. And you did. You did it on camera. You did it in front of a dozen witnesses. You did it with a patient who will recover, which means his family won't sue on his behalf, which means the hospital will simply bury this quietly and move on. And you'll be gone." Katie stood. Her chair made a soft scraping sound against tile. "That's all. Security is waiting downstairs," Pierce said, already turning his attention back to his computer monitor, already composing his next email. She walked out of his office without turning back. Down the hallway. Down the stairs. Into the locker room where she had changed into scrubs 3 years ago on her first day, full of the belief that she would build a career here, that she would heal people here, that this was where her life would take shape. She had been wrong about all of it. The combination lock spun 3 times. Red, 34. Blue, 12. Red, 19. The locker door opened with a metallic crack. Inside was the life she had assembled in 2,880 hours of 12-hour shifts. A change of clothes. A dying succulent in a ceramic pot that had lost its glaze years ago. The cracked mug Daniel had made in 4th grade from clay and paint, his handprints pressed into the rim, a mug she had brought to work and never used because she was afraid of breaking it further. And beneath everything, wrapped in tissue paper the color of old photographs, a folded flag. The flag had been presented to her by Commander Marcus Chen 5 years ago, at Arlington National Cemetery, on a day when the sky had been the color of bruises. Her husband's flag. Her husband's final package. The fabric still held creases so sharp they might never unfold. She had carried this flag through her new identity, her erased existence, her 3 years of nursing school paid for by federal funds she was not supposed to know about. She had kept it in a locker at a hospital where she had thought she would disappear quietly, perform her duties without distinction, and eventually fade into the background of American life. The box she found in the break room was cardboard, the kind used for storing supplies. It was already disintegrating. The bottom had begun to soften where someone had spilled coffee months ago. She loaded the mug, the succulent, the folded flag into this failing container, and for a moment she just stood there, holding the weight of 3 years. Security walked her to the employee entrance at dusk. No one stopped her. No one said goodbye. The halls were empty because people had learned not to acknowledge her anymore, had learned that association with Katie Morrison carried professional risk. The rain had started sometime in the afternoon and had not stopped. It fell now with the persistence of punishment, hammering the parking lot, drumming against the overhang above the employee entrance. She pushed through the doors and stepped into the downpour. The cardboard box absorbed water like a sponge. Her scrub soaked through within seconds. The flag photo, the one of her in dress uniform, the one Marcus Chen had taken 5 years ago before presenting her with folded fabric, slipped sideways as the box's structural integrity finally surrendered. She cradled it against her chest, the cardboard beginning to disintegrate in her arms, pieces of it coming apart like her identity, like everything she had carefully constructed coming undone in the rain. The bus stop was 3 blocks away. She walked through Raleigh's downtown, soaking wet, holding a disintegrating box, looking like exactly what she was, someone who had just been fired. A taxi honked as it passed. A man under an umbrella stepped around her without making eye contact. She was invisible again, but this time it wasn't the invisibility of camouflage. This time it was the invisibility of irrelevance. The bus stop had no shelter. She stood in the rain, water streaming down her face, mixing with something else, tears, maybe, or maybe just the storm. The box continued its slow collapse. She was 17 minutes into her unemployment when a figure appeared beside her in the downpour, no umbrella, completely soaked, 17 years old and vibrating with the kind of anger that only adolescence can contain. Daniel. Her son. Her husband's only child from his previous marriage, a teenager she had raised as her own after his father died, a boy who had watched her disappear into nursing school and emerge as someone different, someone quieter, someone carrying secrets that made her eyes look like they belonged to someone else entirely. "Mom," he said, and his voice was sharp enough to cut. "They need to see these." He held up a showbox, water running off its cardboard sides. His jacket was soaked through. His hair plastered to his forehead. In his hands, wrapped in plastic bags that were barely keeping the moisture out, were 3 things. A silver star. A bronze star with V device. 2 purple hearts. Rain hammered the bus stop shelter like automatic weapons fire. Katie Morrison stood with a cardboard box disintegrating in her arms, the cracked mug Daniel had made in 4th grade sliding toward the edge. Her scrubs were soaked through. Her name tag hung upside down. She'd worked at St. Michael's for 3 years. She was leaving as a ghost. The cracked mug tumbled. A hand caught it. Daniel. 17 years old. Furious in the way that soldiers' sons become, protective of a strength the world had tried to break. He stood there in his school jacket, rain plastering his dark hair to his forehead, a showbox clutched under his jacket like it contained something sacred. "Mom, they need to see these," he said. Not a question. Not a request. Katie's composure fractured for exactly 1 second. "Daniel, no." But he was already moving back toward those doors. Back toward the fluorescent lights and the people who'd spent 3 years learning her name only to pretend they'd forgotten it. Katie followed, the cardboard box forgotten on the bench, rain streaming down her face in ways that had nothing to do with the weather. The administrator's office occupied the 4th floor. The walk felt like ascending into a courtroom. Daniel's footsteps echoed like a military cadence, 1, 2, 3, 4, precision born from watching Marines move through his mother's life like it was nothing remarkable. Dr. Pierce was there. Of course he was there. Smirking at the administrator's desk, some document in his hand, the expression of a man who'd already won. Who believed he'd already destroyed her. Daniel dumped the contents of the showbox onto that desk like he was laying out evidence at trial. 3 medals caught the overhead light. A silver star first. The kind earned in sand and blood. Then a bronze star with the V device, the V for Valor, for going into the fire when protocol said stand down. 2 purple hearts last, each one representing a wound that hadn't killed her because Katie Morrison was the kind of woman that bullets tried to avoid. The room went dead silent. Pierce's smirk collapsed like a building losing its foundation. "What? Where did you get?" "They're mine," Katie said. Her voice had dropped an octave. Not the nurse's voice anymore. Not the deferential woman who'd absorbed 3 years of humiliation with a flat stare. This was Captain Katie Morrison, and the transformation was audible in every word. Commander Chen's voice came from the doorway, a rasp that sounded like a man surfacing from deep water. He'd wheeled himself from ICU against every protocol. His face was grey with the effort, bandages visible above the neckline of his hospital gown, but his eyes were locked on Katie with the kind of understanding that comes from serving alongside someone who'd held your life in scarred hands. "That's Reaper 6, he said. Not a question. A recognition. A salute rendered without standing. The Marine liaison officer, a captain with a chest full of decorations and the bearing of someone who'd seen empires fall, pulled the citation from the medal case. His voice carried the weight of official record, the kind of document that changes everything. For extraordinary heroism under fire while providing trauma care during a 12-hour siege in the Hindu Kush, he read aloud, each word landing like a gavel strike. Captain Katie Morrison, Medical Corps. SEAL Team 3, attached to Operation Copper Dagger. Sustained 2 gunshot wounds while maintaining field operations. Refused evacuation. Saved 7 personnel under continuous fire. Commendation signed by the Secretary of the Navy. Pierce lunged for the phone. "This is obviously fabricated, some kind of conspiracy. I'm calling security, I'm calling legal." A hand intercepted him. Not roughly. Just a presence that made the air pressure change. The 2-star general who'd arrived with Chen's unit stood between Pierce and that phone like a mountain. He was smaller than Pierce, maybe, but generals possessed a different kind of size, the accumulated weight of command authority and the knowledge that they'd seen things that would fold ordinary men. He looked at those 3 medals on the desk, then rendered a slow salute to Daniel holding them. "Your mother's service is noted, son," the general said. That's when hospital IT specialist Rodriguez walked in. Rodriguez. The tech guy. The one Pierce had dismissed 1,000 times as he passed the server room. Just fix the printer, just handle the passwords, the kind of invisible infrastructure that keeps institutions running. But Rodriguez had a fade haircut and the bearing of someone who'd done a 20-year contract before settling into Raleigh. Marine vet. The kind who noticed things. He carried a hard drive like it was a live grenade. "Sir, you asked me last month to review our security footage protocols," Rodriguez said to the administrator, his voice steady as a surgical laser. "I found some anomalies. Thought you should see." The monitor illuminated. Timestamp after timestamp. 2:48 a.m., Dr. Pierce in the trauma wing file room, erasing entries from Katie's patient notes with the kind of systematic precision that suggested not panic but calculation. 3:15 a.m., Pierce accessing medication logs, altering counts, creating a false record. Then, and this was the moment the room stopped breathing, Pierce in the stairwell with a junior nurse, coaching her on testimony. Word for word. "Just say she seemed off that night. Tell them she made you uncomfortable." Everything Rodriguez had quietly preserved and reported to the state medical board that morning. Pierce's face went corpse white. You had no right, that's privileged." "You're right," Rodriguez cut him off. "I had no right. But the medical board has had these files for 6 hours." He turned to the administrator. "They opened a formal investigation into Dr. Pierce's conduct at 9 a.m. this morning. I have a confirmation email." The administrator stood. His voice came out Arctic, temperatures that could freeze a man where he stood. "Dr. Pierce, you're suspended effective immediately pending investigation. Security will escort you from the building." Pierce's mouth opened. Closed. He looked like a man watching his own life collapse in real time, the carefully constructed tower of credentials and reputation crumbling to dust. He tried to bluster, threatened legal action, demanded union representation, but his eyes were wild now, the eyes of someone discovering too late that he'd underestimated the woman he'd been hunting. The general spoke quietly, the kind of quiet that carries more authority than any shout. "Captain Morrison saved my officer's life with a field procedure you weren't competent to perform. And you tried to destroy her for it. That makes you not just incompetent, doctor. That makes you dangerous." Security escort came. Not rough, but thorough. Pierce walked past Katie in the hallway, his steps quickening, trying to meet her eyes and failing. She didn't move. Didn't acknowledge him. Just watched him go with that same flat stare she'd perfected over 3 years of standing still while someone tried to erase her. The silence lasted exactly 3 seconds. Then the elevator doors closed. The administrator turned back to Katie. "Captain Morrison, we owe you an apology that words won't cover. Your position is completely reinstated. Effective immediately. And we'd like to discuss a formal review of all allegations placed against you. The medical board will clear you. They already know who you are." But Katie was looking at Commander Chen, at the pale exhaustion that came from pushing through ICU recovery to witness justice. His hand trembled slightly on the wheelchair armrest, not from weakness but from the kind of adrenaline release that comes after a battle ends. "You almost died," Katie said to him. "You didn't let me." His voice cracked like it was held together with string. "Reaper 6. God, I knew something was wrong when you looked at me that first day. But I couldn't, the fog, the medications, and then Pierce said you were just a nurse and I believed." He stopped. "I'm sorry." "Don't be." Katie's voice had settled now into something measured. "You're alive. That's the only score that mattered." 6 months later, Katie Morrison returned to St. Michael's as the new director of emergency medicine. Her real rank was quietly acknowledged. Her record was partially unsealed with Pentagon approval, enough to explain the medals without compromising classified operations, enough to answer the questions people had been asking in hallways and break rooms. She kept the folded flag on her office shelf now. Not hidden in a locker, not tucked away in a cardboard box. Visible. The flag from her husband's funeral 5 years ago, the one Commander Chen had pressed into her hands when his voice broke, the symbol of loss that had driven her into medicine and now stood as a reminder of why she'd stayed quiet so long. Daniel visited on his lunch break from his senior year. Proud. Still protective. He ate the leftover coffee and cookies from the staff meeting and talked about college applications while Katie listened like those moments could be held in amber forever. Commander Chen sent a case of coffee with a note in his careful handwriting, Reaper 6, the good stuff this time. Thank you. For everything. The coffee was expensive. The gratitude was incalculable. Katie passed Dr. Pierce in the parking lot one morning. He was driving a medical supply van now, license suspended pending the medical board's investigation, his career recalibrated into something that resembled consequence. His eyes skated away from hers. Shoulders hunched. She didn't gloat. Didn't acknowledge him. Just kept walking toward the hospital entrance, toward the life she'd earned. That night, Katie gave a lecture to incoming trauma nurses about knowing when rules matter and when lives matter more. A young nurse in the third row, bright-eyed, uncertain, still believing that protocols were absolutes, raised her hand. "How did you stay composed through everything?" the nurse asked. I don't know. I would have fallen apart." Katie measured her words like she was dispensing medication. Some losses demand you stay hidden. Some moments demand you finally be seen. You learn which is which by keeping your hand steady when everything else is breaking. Later, alone in her office with the door locked, Katie touched the folded flag. Her fingers traced the creases, each one a moment of grief held in cloth. She remembered the weight of it in her hand at her husband's funeral, remembered Commander Chen's voice cracking as he offered it to her, remembered 5 years of carrying that weight in cardboard boxes and hospital lockers while someone else tried to make her invisible. She opened her laptop and approved a new clinical protocol for emergency trauma response. Reviewed staffing schedules. Answered emails from nurses who finally wanted her guidance. Ordinary work that had once seemed impossible, that had required her to save a Navy SEAL's life and expose a doctor's sabotage and stand in the rain with a cardboard box falling apart before she could claim the authority that was always hers. The hospital hummed around her, ventilators, monitors, the steady percussion of a trauma center running at midnight. Katie Morrison sat in her office with the folded flag on the shelf beside her medals, the woman everyone had tried to erase finally allowed to be seen. If you made it through Katie's entire story, you already know the truth. The quietest person in the room might just be the one holding it all together. Subscribe for more stories of hidden strength, people who've survived the unsurvivable, and the moment the world finally wakes up to who they've been standing next to the whole time. Like this video, comment what you would have done if you'd been fired for saving someone's life, and hit that notification bell so you never miss a story about a warrior walking among us.